live. With coverage you can count on. This is News Channel 8's Good Morning Connecticut.
7:24 now on a Sunday morning. A long-standing debate among healthcare professionals has been brought to the foreground in the fight in Washington over healthcare reform. Does preventive medicine work, and should new legislation be focusing on funding it? Back with us this morning is Dr. Desmond Ebanks from Alternity Healthcare in West Hartford. Good to see you again. Thanks for being here.
Thanks for having me. It's a very important topic.
When we say preventive medicine, preventive care, what are we talking about?
We're talking about certainly changing the paradigm of where healthcare is now, which is waiting for something to go wrong and then fixing it after the fact. And we're spending a lot of money treating diseases that are potentially preventable.
But there is some debate. There has long been debate about the impact of preventive medicine.
Yes, there has been, and I think some of it is political in that the lawmakers need to get results very quickly, and preventive medicine is not going to give you results this year, next year, 2 years from now. It's a longer term process.
Preventive medicine is one of those things that it's tough to prove that it works because the person didn't get sick. You know what I mean? It's tough to say, well, we were able to prevent that disease from happening because this person took these steps. Well, maybe the disease wouldn't have happened in the first place. So it makes it a tricky thing to prove, right?
It does, but if you look at some of the statistics, the Institute of Medicine suggests 80 to 90% of cardiovascular disease are preventable. World Health Organization estimates that 60% of diabetes is preventable, and the CDC estimates that a third of all cancers are preventable.
And this is where it factors into the debate in Washington now, because funding this kind of preventive medicine could save millions of dollars down the road in treating the diseases, right?
That's correct. In fact, it could save billions of dollars. We spend, between just those three diseases, we spend $2 trillion overall, and those diseases cost about $1.4 billion.
It's hard to wrap your head around numbers like that. I mean, these are astronomical numbers. What kind of things can people do? What are some kind of simple steps that people can take to be considering preventive care?
Yeah. Well, we have to look at what may be common among at least those diseases that can be preventable. One is carrying excess body weight. So you have to be vigilant about the types of food that you eat. We've talked about this on the program before. The Mediterranean diet has consistently been shown to reduce risk of diseases, including heart disease, type 2 diabetes, and cancer.
And these are simple steps, changing your diet a little bit, that aren't that expensive. I mean, you're spending money on food one way or the other. If you spend it on healthier food, you're not having all of this out-of-pocket cost for preventive care.
Well, that's absolutely true, and it's really not more expensive to eat healthy. That's a perception that's out there, and the other perception is that the food is not good. You can eat very, very good tasting food and eat very healthy for the same or sometimes less money than eating unhealthy food.
And along those lines, change your diet. I'm sure exercise, right?
Absolutely. Exercise, you absolutely have to exercise. You need to do aerobic exercise, and you need to do resistance exercise to build muscle, to give your body more muscle to burn energy and burn calories. Stop smoking. That is one of the leading risk factors for heart disease and cancer. And vitamin D is becoming more and more important, and low levels of vitamin D is shown to put people at increased risk of all three of the diseases we're talking about today.
Take preventive steps now, save billions of dollars in the future. Dr. Desmond Ebanks, we appreciate you being here.
Thank you very much.
Alternity Healthcare in West Hartford. If you want more information on preventive medicine, you can find it on the website, WTNH.com. Come on over to the Good Morning Connecticut weekend section of this site. Just about 7:28 now on a Sunday morning. We'll take a break, check the day's top stories and the forecast as we